Welcome back. You're now watching the lifestyle segment of the weekend show brought to you by HoloCrunch.
Crunchy, yummy goodness.
Yum. All right, the topic of discussion today is managing healthcare waste in the COVID-19 era. The COVID-19 pandemic, as we all know, has given us an opportunity to use face masks and other personal protective equipment. But what about the disposal of these personal protective equipments, face masks, hand sanitizer, and what have you? Today on the program, we'll be talking about the proper way to dispose of these items and what the federal government as well as CSOs are doing to ensure that this is implemented across the 36 states of the nation and the FCT. Joining us in today's program, we have
Professor Aliyu Jauro, Director General, National Environmental Standards and Regulations Enforcement Agency, NESRIA. Welcome to the show, sir.
Good morning. It's a
Good
pleasure.
morning. Also, Adiza Ujo. She is the convener, Stewards of Environment for Sustainable Change Initiative, Stop, Don't Drop. Also, my pleasure to welcome Dr. Remi, a lecturer, Department of Environmental Health, Faculty of Health Science, National Open University of Nigeria, also a member of the Environmental Health Council of Nigeria. Welcome to the Weekend Show.
Thank you so much.
welcome, gentlewomen, gentlemen.
Thank you.
You're most welcome. I'll start with you, Professor. What is NESRA doing right now to ensure proper disposal of COVID-19 waste?
Okay, first of all, National Environmental Standards and Regulation Enforcement Agency, that is NESRIA, was established by a National Assembly Act in 2007, and the act was amended in 2018. So the mandate of the agency has to do with ensuring compliance with environmental laws, regulations, policies to do with the entire environment. So as part of our mandate, we have the power to ensure compliance with the provision of clean water, sanitation, environmental health, abatement of also pollution and other issues. So in line with that, and given the condition of COVID-19, the agency sat down and looked at some of the issues. First of all, there's going to be a lot of healthcare waste generation as a result of this COVID-19. And this waste is going to be disastrous if not handled carefully. Secondly, there's need for the use of chemicals for disinfecting surfaces in order to prevent the spread of COVID-19. And thirdly, there is need for the public to be sensitized on the dangers of indiscriminate dumping of especially waste arising from this COVID-19. So based on that, we set up a committee, COVID-19 committee of the agency, to look at all the issues. So in line with that, we developed two sets of guidelines. One to do with the healthcare waste, how to take care of the healthcare waste. The second one to do with how to use, proper use of the chemicals in disinfecting surfaces. So in line with that, we also carried out public sensitization and education. We have a total of 30 states all over the Federation, and we have headquarters in Abuja. So we went round and we visited isolation centers, hospitals, and we carried out sensitization on these two very key issues: how to take care of the healthcare waste and how to use some of these chemicals.
Why only 30 states?
We are present in only 30 states. We are yet to reach the remaining 6 states.
What are the other 6 states?
We have some states like Edo, we have Benin, we have Edo, we have Delta State, we have Yobe State, we have Zamfara, and we have 2 other states I cannot be able to.
I see.
Yes. So usually when we go to these states, we seek collaboration with state government. We make provision for accommodation so that we can go there and start operating. source.
Adiza, I know for a while you've been very passionate about the environment. I remember joining you a couple of years ago to clean up Jabi Lake Park, and I see that Stewards of the Environment has been consistent in such campaigns. Why did your organization choose to focus on managing COVID waste?
Okay, so thank you very much for that question. And so how Stewards of the Environment even started was because of a problem we discovered at our drinking water source, which is at Usman Dam. So we did a cleanup there, and we discovered that there was the presence of medical waste, especially, and other microplastic and a bunch of other waste items that we found there. And as we continued our campaign, we discovered that the Usman Dam is like a containment, a water like a source, and then there were activities of people along the streams was impacting the drinking water source. So we began. That was how we were born, actually. We began campaigning and advocacy around the issues of waste and waste management, especially regards to our drinking water sources and things that are so dear to our health. And so we started this campaign, and it led us to the fact that because of the activities of human activities around the streams or tributaries that connect to Usman Dam, we are faced with a number of problems. So in 2019, we partnered with a German Green Foundation, HBS, and also the Japanese International Cooperation Agency, JICA, and we did a research, and we discovered the presence of pharmaceuticals in our drinking water sources, analgesic and also antibiotics. And so we brought together the stakeholders, the government agencies that are in charge of the different agencies in charge of managing, of course, our drinking water source, our environment, Satellite Island Development Authority. We're happy also to have NESRA present as well. And we began this conversation about managing healthcare waste and what the problems are. And we discovered that there were a lot of gaps, especially because there's a lot of challenge in terms of managing healthcare waste. And if it's not properly managed, it can actually be disastrous for the entire citizenry of the country, especially when it's coming through your drinking water sources. When you turn on your tap and you don't even know what you're drinking. But we know for a fact that Water Board has a treatment facility which treats the water before it gets to the home. But the fact that we're finding this in our environment, in our drinking water sources, created this whole conversation. We started with government agencies. And so February this year, we had a multi-sectoral dialogue. We brought together all the government stakeholders, and we began this conversation, and we identified some of the gaps in this in managing healthcare waste. Directly, those that are generated from the hospitals, the very process of transportation, everything has its own flaws. So we're thinking of how to work with them to kind of address these issues and to kind of fill in the gaps, address these issues. And then suddenly COVID-19 happened, and then COVID-19, a lot of medical waste is being generated, and we're like, okay, so we already have a healthcare system that is not properly managing the waste in the community, because we're finding syringes, with needles intact in our drinking water sources. We're discovering analgesic and antibiotics in our drinking water sources. In our environment, people are exposed to so much damage, Also, when it goes to the dump site, we have so much gaps and so much. So we started engaging more and say, okay, now COVID is here and it's very contagious, right? So how do we now work with government to see that this is actually tackled? So we're getting support to try to work with government agencies and the various agencies involved in managing healthcare waste and, of course, COVID waste to try to address this issue. So we're not backing down until we see a final solution.
You have your work cut out for you, because now you don't only have to worry about the healthcare waste generated by medical professionals, but by also we, the citizenry now. Yes. At a recent briefing by the World Health Organization, they had asked those of us who are not in the medical field to use reusable face masks. Yes. But they've also said prior that those other, disposable face masks are better to prevent COVID-19. So Dr. Remi, what are your thoughts, Professor Remi, what are your thoughts on this?
Thank you so much for that question.
You're welcome.
Yeah, presently there's a lot of waste, medical waste, due to the COVID-19. And my line of thought is actually on the use of face masks, which has become part of our day-to-day dressing now. I actually wore one, but I had to give it up as we came in here. But I wanted to show you the fact that we have to use it now. It's important we use it because of this COVID-19. It's bi-directional protection. It protects you and it protects the other person that is beside you. And there's research to substantiate this, that the face mask is actually potent in preventing the transmission of this virulent virus. So we have come to the level where we have to use the face mask. So I'm just thinking that we have to be proactive concerning management of medical waste in terms, especially in the use of face mask, because you can just imagine the amount of waste that is generated every day. You know, very soon the students, in fact, they've even resumed now, but then they're proposing to resume fully, maybe later in the year. But at the same time, they have to use this face mask. Other medical waste are there, but I'm particular about the amount of waste generated by the use of face mask. So we have to think about it. We have to be proactive. Now, when you go out there, you see that there's a lot of lapses in the treatment and the disposal. I like the NGO here. They say don't drop. But I would like to add something more. Don't drop anyhow and anywhere, especially in this season and era of the coronavirus pandemic. We need to actually be proactive. We need to actually go out there and let people know the dangers surrounding the improper disposal and the improper use of these personal protective equipments, as simple as the face mask. So in my own direction, I think the emphasis, we have to be proactive. We have to upgrade concerning the disposal of this medical waste.
So it sounds to me that you agree with the latest briefing by the WHO that citizens like you and I who do not work in the medical field should wear reusable face masks.
Yes, yes.
So
yes.
to prevent the dumping of face masks, as you said, okay.
Yes, the reusable one, you can reuse it and recycle. So it's better. But then you can, we still have to dispose of them. You know, you use it, and after some time, you just have to dispose of them. Some get slack, some get dirty, some are not efficient. So you just have, there's still that gap of disposal of the face mask. And so we have to really be proactive because, you know, we have to think ahead the kind of hazards that this disposal can cause to the public. It's very, very, very important that we take proactive steps concerning this disposal. It's becoming part of us, part of our daily dressing, part of our going out. Now you are going out, you have to. I saw your instructions here. You can't enter without a face mask. You go to the market, you have to have a face mask. In the marketplace, how is it disposed of? Is there proper disposal mechanism in place in the market? In the schools, in the primary schools, in the universities. And you know, like now, presently now, I've done a bit of just a little research on it. And I noticed that before we have the amount of medical waste being domiciled in the medical section. But now, we have transferred the medical waste into our homes. That's another danger. You use your face mask, you drop it anywhere, anyhow. You don't think that, oh, this place, I dropped it, you just pick it up again and you wear it. That's dangerous. How do you dispose of your disposable face mask even in your home? You know, those are the challenges that are now coming up because of this COVID-19. And we really have to work to get it.
Let me bring back
right.
Professor Aliyu. As a head of a regulatory body, and just like Adiza rightly said, in 2019, JICA, the Japan International Cooperation Agency, reported that most healthcare facilities don't have disposal equipment, no incinerators, no autoclaves, and the likes. Now COVID is here. As a regulatory body, in the 30 states, yes, there's this awareness, but what alternatives are being put in place by the healthcare practitioners to ensure that they dispose of these materials properly?
Actually, as I have mentioned, we have undertaken a lot of sensitization and environmental education in these 30 states and the federal capital. And our teams have visited these isolation centers and the hospitals during this COVID-19 pandemic. And what we discovered was most of the healthcare facilities now, they have some incinerators. So, and in the course of this exercise, we also advise those that do not have to engage the services of accredited healthcare consultants so that they can collect this waste and take them to proper place where they can be treated before the final disposal. Likewise, we always encourage other healthcare facilities that have these incinerators to always take some of the waste coming from other facilities that do not have. Likewise, we ensure that we carry out compliance monitoring. But given this condition of pandemic, there are strict penalties for defaulters, but we feel that now is not the time. Now is time for us to find solution. So what we emphasize is the issue of compliance. We try to make them comply.
You know, I was about to ask you about the deterrents because not all of them will comply. You said there are penalties. What are the type of penalties for such healthcare organizations and practitioners who refuse to comply with these directives?
There are different types of penalties ranging from fines,
okay,
and even an individual can also be jailed if there is a default. And due to the amended act now, so there are stiffer penalties. We can take someone, any defaulter can be brought before a competent court of law, and he can be fined, or he can also be jailed. So very, very soon, we are now, emphasis now is on sensitization and voluntary compliance.
Okay.
But very soon, we'll start taking defaulters to
Prof,
court.
does NESRA have enough funds to carry out its mandate?
Well, when it comes to funding, I don't think there's any organization that can say it's fully funded. But NESRA really were underfunded. I know the economy is now is very, very weak. We all know, but still, I feel the government can do more. They have been trying, and we are always looking forward to government for increase in funding, because we cover the whole 36. We are supposed to cover the whole 36 state of the federation.
I feel left out, that my state is left out. So that's why I'm asking. I think we definitely need to do more and get more funding there. And most importantly, it's such an integral sector, especially now in the midst of a global pandemic. So Adiza, from your findings with your research that you did, what does Nigeria need to do now? We understand the problems that have plagued our nation from time immemorial when it comes to waste disposal, but now in the midst of a global pandemic, what does your research say that we must take? What steps can we take right away in order to, mitigate the looming doom that pretends?
Thank you very much for that question. Everything stems from the fact that individuals need to play their roles first and foremost. We need to start with ourselves, the very smaller units, and that's the individuals, knowing that there is a problem and we have to take action, we have to take steps. We don't have to always wait on government. If we know what to do, we don't have to wait on the government agencies to come and say, okay, you have to do this before you start. So what we found out from our research also is because of the absence of some of this, healthcare waste management systems, we see a lot of shortfalls. I create a picture for you. For example, the hospitals generate waste in the hospitals. There are people who are also at home that are generating, for example, medical waste by virtue of treatment of diabetes. Maybe they have to inject themselves or whatnot. And the disposal of those, for example, is not properly taken into consideration, because in the hospitals, there are guidelines that they have to put them in different, like sharp boxes and different coded bags before disposal. But then also there's the problem of transportation of some of this waste from the hospitals to the final disposal site, because hospital waste, some of them are contagious. So the very process of transporting from the hospital to the dump site is a problem, because some of them are leaching body fluids and others, some of them also are airborne, have that problem which hasn't been tackled. That's on the government side. But we're happy that they're working towards achieving. We're working very closely with them. We're happy about the results that are coming, but it's not enough. You know, and then the final disposal side, we do not have a dump site where medical waste is actually being, you know, properly taken care of, the transfer station where they are actually properly, according to international standards, you know, sterilized or recycled before being disposed. And then at the dump sites, you're having scavengers who are scavenging through different recyclables, and they're exposed to this waste. Also, you don't even have to go to the dump site. In our various communities, open dumps, and you see the scavengers, the Ebola, scavenging through the waste, exposed to all of these sharps and all this medical waste that have been either used at home or used by, you know, for example, drug users and all of that, exposing everybody. So it all starts with the very unit, us as individuals. And now with COVID, we're already hearing a lot of sensitization and awareness about the masks, for example, how COVID is able to stay on surfaces like wood, plastic, you know, and if we do not take it seriously, like you go to the suburbs and people are not wearing their masks, they don't really care. They're like, okay, it's the rich man's problem, it's not our problem. You know, it's the rich people that are dying, it's not us who are dying. We see that nothing is happening here. It shouldn't take, like something that takes them unawares, like a surprise, you know, like a pandemic happening there or people dying before they realize that this thing is serious. In other countries, people are taking steps, and we can see that the COVID in those countries, the amount of COVID cases are reducing, you know, but here we say, okay, you know, but it all starts with the individual, the very unit of, you know, people taking responsibilities.
Dr. Remi, you spoke about the fact that students are now going back to school.
Yeah.
As adults, we can take care of ourselves. We can wear masks, we can even wash them and iron it, which a lot of adults are not doing. But it was reported that children are less vulnerable. However, recent findings have shown that a lot of children have started contacting the virus. What role do parents and caregivers have to play ensuring that at that immediate and primary point of contact with the children, they're ensuring that these children are protected from the virus? With their masks and how they handle it? What role do the parents and caregivers have to play to ensure that this is taken care of?
Well, thank you so much. I think, just like she says, we need to take individual responsibility. You know, as parents and everyone, you have to teach your children and encourage them. Let them know the implication, no matter the age of that child. Once you are going to school, you have to know the implication, even if you cannot really comprehend, but you can know the implication of wearing your mask, especially the teachers too. You know, all the stakeholders concerning education can bring it to the children and educate the parents, you know, to know the importance of using the face mask, especially in this season of the corona pandemic. And then even, like I mentioned earlier, the challenge I look at is actually the disposal of this face mask. You know, teachers, educators have to be proactive to actually educate the children, the parents, everybody working together. Now, it has to be a lot of collaboration so that we don't encourage the transmission and the spread of this virulent virus. So I think if we work in collaboration together, the most important part of this incidence of coronavirus is that it is easily transmittable, and the effect is not very interesting health-wise. So the main focus should be how to prevent the transmission. It still boils back to the proper handling, waste disposal of these personal protective equipment, especially the face mask, because that's what we all have to wear, even children. And then the other aspect of washing your hands, keeping social distance. There's some group of children that I'm trying to teach an alternative to greeting in the cultural way. You know, instead of coming close, you can just shake your shoulders and the person knows that you are greeting him or her. So all these steps we have to put in place before the proposed resumption to prevent skyrocketing the incidence of this COVID-19.
Most definitely. Thank you so much, Dr. Remi, Adiza, Professor Aliyu. Thank you for coming on the weekend show. We hope you will exceed when next we call on you to discuss such an integral topic.
Thank you so much.
All right, then. We'll take a short break right now. When we return, more on the weekend show. Don't go anywhere.